Hey there, I kept trying to write a response to this, but there were so many things that I wanted to say. I figured I would just do a quick video before I get into the specifics here. I just wanted to say I'm really sorry that your family is dealing with this. Eye inflammation stuff is very stressful and scary, and so I hope that you find relief soon. Okay, so first of all, the infusion that I get is infliximab, specifically inflectra. So you might have heard of remicade. That's the brand name for this medication. And inflectra is what's known as a biosimilar, which is, you can sort of think of it as being like a generic. It's a cheaper formulation that pharmacologically does the same stuff. Now, it's worth mentioning that infliximab is not actually approved for treatment of uveitis. However, it is a TNF inhibitor, and humira, which is also a TNF inhibitor, has been proven to treat and prevent flares of uveitis. So it's reasonable to suspect that the infliximab is the reason why my inflammation has been under control for so long. The reason why we used infliximab instead of humira is that I actually tried humira first, and it didn't work. And also I have Crohn's, and inflectra/infliximab is known to be very effective for Crohn's. So we switched to that, and it's been working for me. Now, that being said, I do just want to make it clear that infusions are not magic, and they take time to build up to therapeutic levels. So most biologics will have what's known as a loading dose, which is a series of more frequent doses, basically, that will occur first. And the hope is that that will get you to kind of therapeutic levels, and then the maintenance doses are less frequent. But again, it can take anywhere from, a few weeks to even a couple of months for these medications to work. So in the short term, it's very important for inflammation to be treated with steroids. I'm not a doctor, and I'm certainly not an ophthalmologist, but my understanding is, and the way that I was treated was very aggressive prednisone first. I had panuveitis, which meant that I had inflammation of my retina, so we had to treat very aggressively to prevent me from going blind. But you can't stay on steroids forever because they have really deleterious side effects, especially when used long term. The last thing that I wanted to mention quickly was about this pressure thing that you mentioned. Unfortunately, eyes are really complicated, and I'm not a doctor, but my understanding of this is that, visual acuity and high intraocular pressure can be related to each other, but there's so many structures and there's so many different ways in which intraocular inflammation can hurt your vision. And so just getting the pressure normalized doesn't necessarily mean that the underlying problem has been fixed.